We explored 6 different regimens or treatment protocols, including paclitaxel or nab-paclitaxel as chemotherapy with and without carboplatin, and then followed by AC chemotherapy all the way through with pembrolizumab. The study showed and developed a feasible combination that was then taken forward into a phase 3 trial called KEYNOTE-173, which will ultimately define the benefit of adding pembrolizumab to neoadjuvant chemotherapy. What we saw in KEYNOTE-173 is that the combination of immune checkpoint inhibitors and neoadjuvant chemotherapy is feasible and it is safe. We found a very promising early, obviously preliminary pathological complete response rate in this trial. It seems that the path-CR rate, the pathological complete response rate, which is the disappearance of all invasive cancer, that this rate is higher for patients who get a combination of platinum and taxane, obviously with pembrolizumab, and that was one of the reasons why this was selected to be taken forward into the phase 3 trial KEYNOTE-522. We also, at this very early time point with just over 19 months of follow-up, have looked at event-free survival, and of course we need to be very careful. It's a small study with very few patients, but what we have seen so far is only 3 recurrences, and these were recurrences in patients who received platinum-free treatment, which was only 10 patients in the trial, whereas in the 50 patients who received platinum-based therapy, there has not been tumor recurrence so far. What we make of those data is difficult to say at this stage, but it's obviously an encouraging early sign, as patients often relapse relatively early with triple-negative breast cancer. This also includes patients who had residual tumor at the time of surgery after neoadjuvant chemotherapy, and again, even in those patients we have not seen any recurrences. Of course, we will need to follow up these patients further and update the EFS data over the months and years to come.